consist of four main elements. Chambers. Valves. Coronary arteries. Nerve conduction system. Most common cardiac complaints symptoms. Chest pain. Palpitation. Dyspnea, shortness of breath. Dizziness. Syncope. Visit your cardiologist. In cardiac clinic, nurse will take your vital signs. Vital signs are blood pressure, heart rate, respiratory rate, temperature, oxygen saturation. Normal BP reading for adults. Normal heart rate range, 60 to 100 beats per minute. Normal respiratory rate range, 12 to 16 per minute. Normal oxygen saturation, 95 to 100%. Normal body temperature. This will take also your height and weight BMI. diagram. Echo will help to diagnose heart failure weakness. Valves problems. Including mostly valve regurgitation leakage, or valve stenosis narrowing. Valves regurgitation. Valve stenosis. Echo could help detect fluids around heart. Heart tumors. Congenital, since-born, anomaly, like holes. Chest X-ray. X-ray will help fast detection of heart size and fluids. Lab tests. Most importantly, heart enzymes, like troponins and proBNP. Troponins help detect early heart attacks. proBNP enzyme, useful in heart failure. Other lab tests are useful also to understand your general health and aid for treatment plan. Other lab tests are useful also to understand your general health and aid in treatment plan. Blood sugar is important risk factor also for coronary artery disease. HbA1c is important test to know about your serum glucose level average last 3 months. and will estimate your kidney function. Kidney function impairment is bad indicator for heart disease. Urine microalbumin is the amount of trace protein in the urine, and if it exceeded certain level it is a sign of deteriorating of kidney function. Uric acid if high levels it will affect your blood pressure and heart in bad way. Liver function tests also important for treatment plan and medication selection. Thyroid function tests, like TSH, important in some cases in cardiac assessment. Vitamin B3 level is also important in selected patient in cardiac evaluation. Exercise ECG test. An exercise stress test, or exercise ECG, is an electrocardiogram that is recorded while you are exercising on a treadmill. If you get a chest pain or feel uncomfortable when you are being physically active, this test can help you tell if your symptoms are caused by angina, a type of pain that is usually due to coronary heart disease. Already know you have coronary heart disease, an exercise ECG can give more information about how severe your condition is, as it lets doctors see the changes to your ECG waveform while you are doing exercise. The ECG waveform is the pattern of the rhythm of your heart. If you have recently had heart surgery, an exercise ECG can also help doctors decide what level of exercise you should do as part of your cardiac rehabilitation program. Wear light, comfortable clothes and shoes and do not have a heavy meal before you have your ECG. Exercise raises your pulse rate, however this effect shows up less in people who are taking beta blockers, a type of medicine for the heart. If you take beta blockers, the doctor may advise you to stop taking them for 1 or 2 days before the test. Several small sticky patches are put in your chest and connected to an ECG recorder to monitor your heartbeat. You will then be asked to exercise, starting off at a very easy rate. Gradually, the exercise made harder either by increasing the speed and/or the slope of the treadmill. A doctor or specially trained technician will carefully check your ECG reading, blood pressure and pulse. The staff will tell you when to stop, usually when they have the measurements they need. They may also tell you to stop if you start getting chest pains, or if you get tired or very short of breath. They will take more ECG readings after you have stopped exercising. exercise test usually lasts approximately 45 minutes. You will not be on the treadmill for this long. Pulsar 24-hour ECG recording. This technique involves continuously recording an electrocardiogram (ECG) over 24 hours. It is usually done as an outpatient and is safe and painless. It can help to diagnose symptoms such as palpitations, which don't happen very often. To make 2 visits to the hospital, once to have the recorder fitted and once to return it. Small sticky patches are put in your chest with wires or attached to these and are taped down. The wires lead to a small portable tape recorder which you wear on a belt round your waist. Comfortable and quiet, so you should hardly be aware of it. You can do everything you normally do, except have a bath or shower, and it is best to wear loose clothing. The doctor will ask you to spend a normal day and do any activity which might bring on your symptoms. You will also need to keep a simple diary, writing down what activities you do and when, and making a note of any times when you have symptoms such as palpitations or dizzy spells. When the ECG is analyzed later, the doctors will pay special attention to the recordings of each time, which is why it is important to fill in your diary accurately. Often the doctor will arrange for 24-hour recordings to be made for 2 or 3 days in a row, in some cases up to 8 days. You will get the results of the monitoring a few days later. A 24-hour ECG recording may show a fast or slow heart rhythm that may need treatment. It can also reassure you if you think you have palpitations but are in fact just over-aware of your normal heartbeat. ABPM, ambulatory blood pressure monitoring. This is a test whereby your blood pressure is recorded at regular intervals over a 24-hour period. On a belt around your waist, you wear a portable recorder which is attached, through tubes under your clothes, to a cuff which is wrapped around your arm. You carry on with your normal daily activities and, every hour or so, the cuff automatically inflates and measures your blood pressure. The recorder keeps a record of each blood pressure measurement and the time that it was taken. The next day, when you go back to hospital, the device is taken off. It then prints out a record of all the blood pressure measurements made during the previous 24 hours. This test gives an overview of all the blood pressure readings throughout the 24 hours. It is particularly useful if your doctor thinks that your blood pressure is unusually high when you have it measured in a surgery or a hospital appointment. CT coronary angiogram or CTCA. CTCA is a scan that records pictures of your heart. Before the pictures are taken, dye is injected into a vein usually in your arm. The dye highlights any blockages in your coronary arteries, helping to diagnose there is a narrowing of the diameter of the vessel. It is measured to determine the amount of blockage. The angiogram does not show plaque embedded inside the vessel wall, however. Depending on what is found, angioplasty or bypass surgery may be recommended to restore blood flow. Myocardial perfusion scan. Myocardial perfusion is an imaging test. It's also called a nuclear stress test. It is done to show how well blood flows through the heart muscle. It also shows how well the heart muscle is pumping. For example, after a heart attack, your doctor may order this test to find areas of damaged heart muscle. This test may be done during rest and while you exercise. A myocardial perfusion scan uses a tiny amount of a radioactive substance, called a radioactive tracer. The tracer travels through the bloodstream and healthy heart muscle absorbs it. On the scan, the areas where tracer has been absorbed look different from the areas that do not absorb it. Areas that are damaged or don't have good blood flow do not absorb the tracer. Cardiologist may advise you to be admitted in CCU. A coronary care unit (CCU) or cardiac intensive care unit (CICU) is a hospital ward specialized in the care of patients with heart attacks, unstable angina, cardiac dysrhythmia and, in practice, various other cardiac conditions that require continuous monitoring and treatment. Common heart disease drugs. There are many drugs prescribed for heart disease. It's important for people with heart disease and those who care for them to understand the meds, follow the labels, and recognize possible side effects. The ones most people with heart disease are given by their doctor include ACE inhibitors. These widen arteries to lower your blood pressure and make it easier for your heart to pump blood. Aldosterone inhibitors. Aplurinon, Inspra, and spironolactone, aldactone, are part of a class of medicine called potassium-sparing diuretics. They can ease the swelling and water buildup heart disease can cause. They help the kidneys send unneeded water and salt from your tissues and blood into your urine to be released. Aldosterone inhibitors. These drugs may help some symptoms, even while you take other treatments. They protect your heart by blocking a chemical in your body called aldosterone that causes salt and fluid buildup. This medicine is for folks with some types of severe heart failure. Beta blockers. They block the effects of adrenaline, epinephrine. This helps your heart work better. These meds also drop production of harmful substances your body makes in response to heart failure. And they cause your heart to beat slower and with less force. Those both lower your blood pressure. Calcium channel blockers. These treat chest pain, your doctor may say, angina, and high blood pressure. They relax blood vessels and increase blood and oxygen to your heart. Cholesterol-lowering drugs. Cholesterol helps your body build new cells, insulate nerves, and make hormones. But inflammation may force cholesterol to build up in the walls of your arteries. That buildup increases your chance of having a heart attack or stroke. Some people's genetics make it more likely that they'll have high cholesterol. These folks may need drug therapy, like statins, in addition to a healthier diet, to lower the chance that they'll get hardening of the arteries. Digoxin. It helps an injured or weakened heart to send blood through the body and work more efficiently. It strengthens the force of the heart muscles' contractions. It may improve blood circulation. You may be prescribed this if you have an irregular heartbeat. Inotropic therapy. This helps make an injured or weakened heart pump harder to send blood through the body. Administered through IV, it helps strengthen the heart muscles' contractions. You may get this if you have end-stage heart failure to help relieve and control your symptoms. These medicines are used only when others have stopped working on symptoms. Potassium or magnesium. You can lose these electrolytes when you pee more while you take diuretics. That loss can cause abnormal heart rhythms. Ask your doctor if you should take supplements to make up the difference. Proprotein convertase subtilize and Cushing type 9 PCSK9 inhibitors. You may get this new class of cholesterol-lowering drugs if diet and statin treatments aren't helping. Vasodilators. These relax your blood vessels so blood can flow more easily through your body. You'll get these if you can't take ACE inhibitors. Warfarin. This helps prevent clots from forming in your blood. You'll get it if your body is making blood clots, or if you have a condition that helps cause them. This medicine won't dissolve a blood clot. Over time, the clot may dissolve on its own. Warfarin may also prevent others from forming. New oral anticoagulants. NOACs. In the last few years, FDA has approved 3 new oral anticoagulant drugs, Pradoxip dabigatran, Xarelto, rivaroxaban, and Eliquis, apixaban. Like warfarin, all 3 are blood thinners that reduce the overall risk of stroke related to atrial fibrillation, but they also cause bleeding. Antiarrhythmic drugs. Antiarrhythmic drugs may be prescribed if you have tachycardia, fast heart rate, or premature or extra heartbeats. These medications work to correct the rhythm of your heart. They restore a normal heart rhythm by changing the electrical current that makes your heart beat. Antiplatelet agents. Antiplatelets are medicines that prevent blood clots from forming. They are widely used in primary and secondary prevention of thrombotic cerebrovascular or cardiovascular disease. Most common antiplatelets are aspirin and Plavix. Most common cardiac diagnosis. Angina and heart attack. Angina. Is it angina or a heart attack? Angina symptoms like chest tightness or discomfort are very similar to warning signs of a heart attack. Angina happens when your heart isn't getting enough blood, usually because of narrowed coronary arteries. Your heart may try to improve its blood supply by beating harder and faster. This causes symptoms of angina and is a sign that your heart needs to rest. The key difference between angina and a heart attack is that angina is the result of narrowed rather than blocked coronary arteries. This is why, unlike a heart attack, angina does not cause permanent heart damage. Symptoms of angina. Angina symptoms differ from person to person, but can include discomfort, heaviness or tightness of the chest which may spread to the back, shoulders, neck or jaw. Other people describe it as a dull ache. Discomfort in the arm, neck or jaw with no chest discomfort. The discomfort can range from mild or dull to severe. Preventing angina. If you smoke, quit smoking. Take your medications as prescribed. Make heart-healthy eating and drinking choices. Move more. If you are overweight, lose weight. Heart attack symptoms. You get a heart attack when blood flow to your heart muscle gets restricted or blocked, often by a clot in an artery. Without oxygen, your heart muscle gets damaged or could even die. Your chest pain may feel like discomfort, pressure, tightness, burning, fullness, squeezing. Other angina symptoms mostly in women. Indigestion, palpitations, nausea, numbness in the hands, unusual and overwhelming fatigue. Other angina symptoms. Discomfort in the neck, arms, jaw, back, or stomach. Shortness of breath, dizziness, cold sweat. Take it seriously. Angina is a warning sign. It's basically giving you a heads up there is a problem. It's telling you your heart muscle is not getting enough blood. There is a narrowing in your artery that can lead to a clot that could give you a heart attack. Don't ignore it. Your doctor can recommend medications, balloon angioplasty, stents, or bypass surgery to open up your arteries and make sure your heart gets better blood flow. Heart attack. A heart attack, myocardial infarction or MI, is a serious medical emergency in which the supply of blood to the heart is suddenly blocked, usually by a blood clot. A heart attack is a medical emergency. Call 999 and ask for an ambulance if you suspect a heart attack. A lack of blood to the heart may seriously damage the heart muscle and can be life-threatening. Symptoms of a heart attack. Symptoms of a heart attack can include chest pain. The chest can feel like it's being pressed or squeezed by a heavy object, and pain can radiate from the chest to the jaw, neck, arms and back. can then swallow a tablet of aspirin, ideally 300 milligrams, as long as the person having a heart attack is not allergic to aspirin. In hospital, treatment for a heart attack depends on how serious it is. The two main treatments are using medicines to dissolve blood clots, surgery to help restore blood to the heart. Causes of a heart attack. Coronary heart disease, CHD, is the leading cause of heart attacks. CHD is a condition in which the major blood vessels that supply the heart get clogged with deposits of cholesterol, known as plaques. Before a heart attack, one of the plaques bursts, ruptures, causing a blood clot to develop at the site of the rupture. The clot may block the supply of blood to the heart, triggering a heart attack. Recovering from a heart attack. The time it takes to recover from a heart attack will depend on the amount of damage to your heart muscle. Most people can return to work after having a heart attack. Some people are well enough to return to work after 2 weeks. Other people may take several months to recover. How quickly you can go back to work depends on your health, the state of your heart, and the type of work you do. The recovery process aims to reduce your risk of another heart attack through a combination of lifestyle changes such as eating a healthy diet and medicines such as statins, which help to lower blood cholesterol levels. Gradually restore your physical fitness so you can resume normal activity, cardiac rehabilitation. From person to person. They may start suddenly or develop gradually over weeks or months. The most common symptoms of heart failure are breathlessness. This may occur after activity or at rest. It may be worse when you're lying down, and you may wake up at night needing to catch your breath. persistent cough, which may be worse at night, wheezing, a bloated tummy, loss of appetite, weight gain or caused by changes in heart tissue and activity or in the electrical signals that control your heartbeat. These changes can be caused by damage from disease, injury, or genetics. Often there are no symptoms, but some people feel an irregular heartbeat. You may feel faint or dizzy or have difficulty breathing. The most common test used to diagnose an arrhythmia is an electrocardiogram, EKG or ECG. Your doctor will run other tests as needed. Dizziness. Is a term used to describe a range of sensations, such as feeling faint, woozy, weak or unsteady. Dizziness that creates the false sense that you or your surroundings are spinning or moving is called vertigo. Dizziness is one of the more common reasons adults visit their doctors. Frequent dizzy spells or constant dizziness can significantly affect your life. But dizziness rarely signals a life-threatening condition. People experiencing dizziness may describe it as any of a number of sensations, such as a false sense of motion or spinning, vertigo, lightheadedness or feeling faint, unsteadiness or a loss of balance, a feeling of floating, wooziness or heavy-headedness. These feelings may be triggered or worsened by walking, standing up or moving your head. Your dizziness may be accompanied by nausea so sudden or severe that you need to sit or lie down. The episode may last seconds or days and may recur. Dizziness has many possible causes, including inner ear disturbance, motion sickness or medication effects. Sometimes it's caused by an underlying health condition, such as poor circulation, infection or injury. The way dizziness makes you feel and your triggers provide clues for possible causes. How long the dizziness lasts and any other symptoms you have also helped pinpoint the cause. Blood that flows to the brain. Syncope can happen if you have a sudden drop in blood pressure, a drop in heart rate, or changes in the amount of blood in areas of your body. This procedure takes about 1 hour in most cases. You will be given a sedative to help you relax. You will be awake during the procedure. Implantable cardioverter defibrillator (ICD). ICDs are useful in preventing sudden death in patients with known, sustained ventricular tachycardia or fibrillation. Studies have shown ICDs to have a role in preventing cardiac arrest in high-risk patients who haven't had, but are at risk for, life-threatening ventricular arrhythmias. Here we'll see 4 cases. First one, bad cardiac arrhythmia following major heart attack. Second one, for valve regurgitation, in part cardiac muscle weakness. Third one, radiological shape of coronary artery plaque. Fourth one, primary angioplasty in acute heart attack. Please watch to the end of cases. Like, share and subscribe. If you have any question, please do not hesitate to send an email. This video has been made for educational purposes.